Bismillahirrahmanirrahim. Now we are going to start the second bone of the upper limb, the scapula bone. It is also called as the shoulder bone. It is a thin plate of bone, large flat triangular bone, lies on the posterior chest wall. It lies between the second and the seventh ribs. It is present on the posterior lateral aspect of the thoracic cage, and the scapula has three borders: the superior, medial and lateral border, three angles, superior, inferior and lateral angles, the two surfaces, the costal surface and the dorsal surface, and the three large bony processes, the spine, acromion and the coracoid processes. To find out the side to which the scapula belongs, like whether it is a right side bone or the left side scapula bone, first of all, we'll consider the lateral end. This end lies laterally. It is also called as glenoid angle, and it is a large end and it bears the glenoid cavity. Next, the surfaces. This is the dorsal surface, means it is on the posterior side. It is convex and it is divided into the triangulars by the triangular spine into infraspinous fossa and the supraspinous fossa above. The costal surface, which is anteriorly, it is occupied by the subscapular fossa to fit on the convex chest wall. So this is anteriorly costal surface and this is posteriorly the dorsal surface. Now the last point is the lateral border. The lateral border is the thickest border, runs from the glenoid cavity above to the inferior angle below. So by these 3 points we will find out the side to which this scapula bone belongs. Now the features of the scapular bone. It has two surfaces, the costal surface or the subscapular surface, which is present anteriorly on the costal side. It is concave and it is directed medially and forwards. It is marked by the three longitudinal ridges. This part of the bone is almost rod-like and it acts as a lever for the serratus anterior muscle in overhead abduction of the arm. Second surface is the dorsal surface. It is present posteriorly on the dorsal side and it gives attachment to the spine. The spine divides the dorsal surface into the smaller supraspinous fossa and the larger infraspinous fossa. These two fossa are connected by the spinoglenoid notch. This is the notch which is situated lateral to the root of the spine. So this notch connects the supraspinous fossa above and the infraspinous fossa below. These are the two surfaces of scapula bone. The scapula has three borders. The superior border, which is thin and shorter, near the root of the coracoid process. This is the coracoid process. It has a notch which is called as suprascapular notch. This is the notch in the superior border of scapula. And it has a lateral border which is present, which is the thickest part. It is present from the upper end of the glenoid cavity to the inferior angle. At the upper end, it has a infraglenoid tubercle. This is the infraglenoid tubercle in the lateral border. The medial border, this is the thin border. It extends from the superior angle to the inferior angle. These are the three borders: the superior, lateral border and the medial border. Scapula has three angles. The superior angle, it is present along the junction of the superior and the medial border. And then the inferior angle, present at the junction of medial and the lateral borders. The inferior angle moves forward around the chest when the arm is abducted. Then the lateral angle, which is also called as glenoid cavity, it is broad and bears the glenoid cavity or the fossa. the lateral angle is present at the junction of the superior and the lateral borders. The inferior angle of the scapula can be palpated easily in the living subjects, and it is marked the level of 7th rib and the spine of the 7th thoracic vertebrae. So these are the three angles of scapula: the superior angle, the inferior angle, and the lateral or glenoid angle. The scapula has three processes. The spine or spinous process, it is a triangular process. It is a triangular ridge that runs laterally from the medial border of the scapula to merge to the acromion process. The spine has three borders: one border, the lateral border, and three borders and two surfaces: the above surface and the below surface. It divides the dorsal surface of the scapula into the supraspinous fossa and the infraspinous fossa. The posterior border, it is called as the crest of the spine. The crest has upper and lower lips. Now the second process is the acromion process. The acromion process is broad, flat lateral extension of the spine of the scapula. This form the easily palpable tip of the shoulder. It partially roof over the glenoid cavity and provide the articulation with the clavicle at the acromioclavicular joint. So this is the acromion. Acromion has two borders, medial and lateral, and two surfaces, superior and inferior, and a facet for the clavicle. The last process is the coracoid process. It is directed forward and slightly laterally, and it is bent and finger-like. It is atavistic type of the epiphysis. The coracoid process projects anterolaterally from the junction of the neck and lateral end of the superior border of the scapula. It can be palpated via deep pressure through the anterior part of the deltoid inferior to the lateral end of the clavicle. So these are the three processes: the spine or spinous process, the triangular part, the acromion process, and then the coracoid process. So the scapula, we have discussed, has two surfaces: the costal surface, the dorsal surface, which is divided into supraspinous and the infraspinous fossa by a spine, and it has three borders: the superior border, the medial border, and the lateral border. It has three angles: the superior angle, the inferior angle, and the lateral angle. And it has three processes: the spinous process, which is triangular, the acromion process, which is the lateral extension of the spine, and then the coracoid process. So this is all about the scapula.